Greetings of the day, everyone. I'm privileged to welcome you all into the Health Talk series organized by the Student Council of Sadabai Rai Sone Women's College, supported by SGR Knowledge Foundation and powered by Rai Sone Group of Institutions. Today, we will be talking about the issues that every female faces during adolescence, which every female faces during adolescence and which is not given so much of attention. The female reproduction system is designed to carry out several functions. Females of reproductive age experience cycle of hormonal activity that, that repeat at about 1 month intervals. We will learn more about this in today's Health Talk session on women reproduction system and effects with Dr. Anamika Gupta. I welcome you, ma'am. Anamika ma'am is a working achiever. She has completed her MBBS from College of Medicine and JNM Hospital Kalyani, MD Anesthesiology and Critical Care from King George Medical University, Lucknow, Uttar Pradesh. Presently, she is working as a senior resident in KGMU, Lucknow, Uttar Pradesh. Welcome, ma'am. I am Nishtha Shambharkar. Welcome you in Health Talk series on behalf of all. Now, without any further ado, I hand over.
Thank you, Nishtha. Thank you for this warm welcome. I'm here to talk on the topic of female reproductive system. So, hello everyone. I'm Dr. Anamika Gupta. Today I will talk about female reproductive system. So, to begin with my topic, I'll share my. Hello everyone. I, Dr. Anamika Gupta, here to talk about female reproductive system. So, to begin with my topic, first I will tell you the parts of the female reproductive system. So, can you please show the next slide? Yeah, this. Okay. So anatomy of the female reproductive system. It consists of two ovaries continuing with the fallopian tubes on each side of the uterus. The uterus continues with the cervix and vagina externally. Moving to the physiology of reproductive system. Next slide, please. Okay. So primary reproductive organs, also known as gonads. The primary reproductive organs in females are ovaries and in males are testes. These organs are responsible for producing eggs and sperm cells, also producing hormones, so that the maturation of the responsible for the maturation of the reproductive system. Also helps in the development of sexual characteristics. It regulates normal physiology of reproductive system. Next slide, please. So sex hormones, these are the hormones which are responsible for our gender determination. In males, androgen, basically testosterone, and in females, these are estrogens and progesterone. Functions of these sex hormones are to develop the reproductive organs and to develop the sexual behaviors. Next slide. Yeah. These are the other hormones responsible for the normal physiology of reproductive system. First is follicle stimulating hormone, also known as FSH in short. It stimulates the follicle development inside the ovary and estrogen secretions in females, while in males it is responsible for sperm production. Second is luteinizing hormone. Luteinizing hormone causes ovulation and progesterone production in females, while in males it is responsible for androgen production. There is a third hormone, prolactin, which is mainly found in females, responsible for the development of mammary glands and production of milk. Next slide, please. Okay. So, to coming to the menstrual cycle, what is normal menstrual cycle? Day should be 3 to 4. It depends on the hours we are going to change the periods. So change of periods is recommended every 6 to 8 hours to maintain the hygiene. Next slide, please. Okay. So begin with the day one of the menstrual cycle. On the day one, GnRH is a hormone, gonadotropin releasing hormone. It is secreted from the pituitary gland, which is the main gland of our body. So GnRH secreted from the pituitary gland stimulates the release of FSH and LH, which stimulates follicle growth inside the ovary and its maturation, and low level of estrogen release. The rising estrogen follicle converts into the corpus luteum, which produces inhibin, progesterone, and estrogen. So, inside the ovary, these two hormones, estrogen, progesterone, along with the inhibin, are produced by the corpus luteum. Estrogen then shuts off FSH and LH release and declines the LH, ends the luteal activity. And continuing till the day 26 to 28. On this 26th day, the ovarian hormone level decreases, the blockade of FSH and LH ends, and the cycle starts afresh. So, this diagram is showing the cut section of ovary, inside which you can see the small primary follicles. These primary follicles are developing into secondary follicles, and secondary follicles are developing into mature Graafian follicle. This Graafian follicle contains ovum inside it. When this Graafian follicle ruptures, it releases the ovum outside the ovary, and this ovum is taken this ovum is released into the fallopian tube, and from the via the fallopian tube it comes inside the uterine cavity, where if there is sperm, so then the fertilization will happen and the implantation of the embryo will occur inside the cavity. And this is when pregnancy begins. But in the absence of the sperms inside the cavity, this ovum gets like destructed, and the uterine cavity was already prepared for the upcoming implantation. So now that the implantation has not happened, this innermost lining of the uterine cavity will slough out slowly through the vagina, uh, manifesting as bleeding per vagina, known as menstruation. So this is the normal menstrual cycle. Next slide, please, Nishtha. Okay. So again, this diagram is showing the the flow chart showing this hormonal balance inside our body, leading to the normal menstrual cycle. This you can see this diagram graph is showing the level of FSH and LH hormone inside our body throughout the cycle. So what happens is from the day 1 to day 14. This is the day 14, where you can see the red color lining, peak of LH hormone. The peak of LH hormone corresponds with the release of the ovum. So FSH and LH in initial days, they are in they are low in volume, and when the LH surge occurs, it corresponds with the release of the ovum, and after that ovulation has happened. So the corpus luteum, the ruptured follicle will convert into corpus luteum, which will now secrete estrogen and progesterone. In the lower section of this graph, you can see the level of estrogen and progesterone level mentioned. So this level of these hormones increases, and this shuts off the FSH and LH release, and begins with the new cycle afresh. Coming to the next slide. Okay. Now I'll tell you the few terms which we use in medical. The terms everyone should be aware of. The first is menarche. Menarche is nothing but the first period in a woman's life. What is menorrhagia? Menorrhagia is excess bleeding. As I have already told you, excess bleeding is when more than 80 ml per period. Then it will call menorrhagia. Hypomenorrhea is less bleeding when if you are menstruating but the bleeding amount is very low, that is less than 2 days or less than 2 to 3 days. Then it is called hypomenorrhea or oligomenorrhea. And then comes the most important term PCOS, PCOD, we call it polycystic ovarian syndrome. The incidence of this syndrome is increasing very fast due to changing lifestyle of our generation. Then comes the term premenstrual symptoms, which many of you must be aware of PMS. And then STDs, sexually transmitted disease. But the list is never ending. But I am telling you these few terms because which I assume are important. Coming to the next slide. Okay. So I'll introduce you with this very important entity. This is PCOS, the most common endocrine disorder affecting 5 to 10% females of 15 to 45 years of age. So 5 to 10% means every 100 women in every 100 women who are suffering from PCOS. It could be knowingly or unknowingly. 10 women of with the PCOS. Incidence is increasing too fast because of lifestyle changes. Most frequent cause of infertility in today's world is PCOS. This
I
PCOS,
would, excuse me, ma'am, I would like to ask a question that
okay,
what are the symptoms and what causes PCODs?
okay. I'll tell you these things also. First, I was just highlighting the importance of this PCOD, why you should know PCOD, and how you will diagnose and how you will say this particular person can have PCOD or so. I'll tell you these symptoms and signs.
Okay,
So
ma'am.
this PCOD increases the risk of diabetes, hypertension, obesity, cardiovascular problems like heart attack, myocardial angina, or several other metabolic syndromes. Come next slide, please. Okay, so this is the answer of your question. The
Yes, ma'am.
symptoms and the signs of PCOD. So the age group of these women is 15 to 45, which is reproductive age group only. So from the teenage girls, the 15 can be the age of menarche. When the menarche happens, late delayed menarche or irregular periods or small periods or polymenorrhea with the symptom with abnormal hair pattern, like when you can see the some females with hairs on their face, excess hairs on their face or chin, or you can see the females with obesity, acne, excess hairs. And also this term acanthosis nigricans is nothing but the skin changes associated with the this disorder. This is blackening of the nape of the neck. This is skin changes occurs with this particular problem. And what happens inside is the ovary contains small cyst, like a cyst of various sizes inside it. So this is known as polycystic ovary. And what is the hormonal imbalance is occurring is excess androgen. And androgen, by this time you should know the androgens are male sex hormones. So inside the females there is excess of male sex hormones. So because of that the symptoms are happening. What is insulin resistance? Insulin resistance is because of obesity and these hormonal imbalance. There is excess of insulin inside your body, but the cells of your body are not utilizing insulin because of the resistance. So there is hyperglycemia, continuous hyperglycemia inside your body, which is converting into the glucose is excess. Glucose excess is happening, and this glucose is converting into fats and leading to obesity. And further this obesity insulin resistance is related to diabetes in long term. These are the symptoms. And this obviously previous slide please. Okay, The one thing which is also important is infertility. Infertility, because here the problem is with the hormones, and the hormonal imbalance leads to abnormal bleeding, abnormal cycle, and abnormal cycle is associated with the problem of ovulation. Ovulation, it could be an ovulation which is ovum is not released at all. So there is arrest of Graafian follicle in this. So in those women's, their ovum is not released at all, so they are not able to fertilize the sperm, so leading to infertility. Next slide, please, Nishtha. Okay, so this disease needs to be hunted down at the earliest, not only treated. So you must be aware of the symptoms and signs of this disease, so that if you are suffering, or anyone around you is suffering from PCOS, you must consult the gynecologist. Or so PCOS can be treated, but the main I'll say main treatment is lifestyle changes. You have to have a strict lifestyle, maintain healthy eating, reduce sugar intake, sodium intake. Sodium is like salt intake, and reduce the trans fat intake. Trans fat is saturated fat, which is in oil, ghee, butter, everything. This is a saturated fat. So, and these are the basic thing you have to start from the beginning. So, lifestyle management and diet control is has to be very strict. The other treatment could be birth control pill, oral contraceptive pills. So use of oral contraceptive pills. So many of you have not heard of OCPs. OCP by OCP का नाम सुनने से ही ऐसा लगेगा आपको कि OCP तो हम अब उसके लिए लेते हैं, मतलब कॉन्ट्रासेप्टिव मेथड के लिए लेते हैं. But OCP is not only contraceptive method. What OCP contains these hormones only, estrogen and progesterone. So by use of estrogen and progesterone, this OCPs, we can give these OCPs to the patient of PCOS, so that they can have a regular cycle. Other drugs we can use the metformin. Metformin is a oral hypoglycemic drug for patients, but it has a this use also where it reduces insulin resistance in the body. So other treatment is like symptomatic treatment, where you can check out the acne and you can clear up the skin. Hirsutism is nothing but the abnormal hair pattern in a female. This is excess androgen is known as hirsutism. And PCOS can affect your fertility, obviously. Okay, coming to next slide, Nishtha. Okay. So, but infertility can be treated, of course. There are so many options in our market. First is, I told you, this OCP. You can take OCPs. The interval, the timing of OCPs and timing of other drugs is very important, which on consultation you can ask to the doctor. There are drugs. While the fertility treatment options, there are timed intercourse. Timed intercourse is what? When you are suffering from PCOD, and the women who are trying women who are trying to conceive, they can seek help from the doctors, where they will ask the ultrasound and some blood investigation to determine when the ovulation is happening. So timing of ovulation, doctor will tell, and according to the timing of ovulation, they have to perceive this intercourse. And next is intrauterine insemination. This is another technique in which the sperm is directly inserted into the uterine cavity. And another technique is in vitro fertilization. You all must have heard in vitro fertilization, IVF. The cycle begins by stimulating your ovaries with the medications, and the eggs are then retrieved and fertilized in a lab outside. And while they develop into embryos, then these embryos are taken and are implanted again into the uterus. So successful pregnancy is possible in this PCOS. Next slide, please, Mr. So, what is premenstrual symptoms? What are premenstrual symptoms? Premenstrual symptoms, it's a like very broad term. There, there, there are so many premenstrual symptoms. It varies with women to women. It, like one can have mood swing, another can have cyclical menstruation, pain, lower abdomen, body pain, back pain, appetite changes, bloating, acne, insomnia, easy fatigue. There are so list is never ending. Like it is not necessary that all these symptoms has to happen in a like one woman. सबको अलग अलग symptoms हो सकते हैं and it can occur from 5 to 10 days before your period starts, but it goes away 1 to 2 days immediately after your period starts. Next slide, please. This is also another very important topic for the young women's sexually transmitted disease, an infection transmitted through sexual contact. It could be bacteria, virus, or parasites. The list of these sexually transmitted diseases is very long. Uh, you need not to remember the names of these, but if you can remember the names, it is very good. Bacterial vaginosis, chlamydia, gonorrhea, hepatitis, herpes, HIV/AIDS, human papillomavirus, PID, pelvic inflammatory diseases. The list is very long, but the main thing is, most important thing is prevention. So here for sexually transmitted disease, prevention is the only choice. Oh, okay. So coming to what are the signs and symptoms? What could be the symptoms so that you can like have a assumption that so this is suffering from STD, like sores or bumps, painful or burning urination, odorous vaginal discharge, pain during sex, fever, rash, sore or swollen lymph nodes in groin. These could be signs and symptoms, but thing is, if you are in doubt, abstain. Next slide, please. So prevention is the only choice. List is long, but cure is available only for a few of them. Prevention is only option left here. Use of condoms may or may not prevent it. So abstain, abstain, and abstain. So use of condoms, like everyone thinks the use of condoms is enough to prevent STDs, but no, use of condoms may or may not prevent. So, if you are in doubt, abstain and get vaccinated, get tested at earliest. Don't share your towels, linens, or private things. Okay. Next slide, please. Okay, I think it's over here. Hmm.
Yes, ma'am. After listening to you, I have some questions to ask. So, shall I ask?
Yeah, proceed.
Changes? Yes, ma'am. Ma'am, are there any lifestyle changes that I can make to have maintain a healthy normal period?
Lifestyle changes are associated, like these are exercise. You have to exercise daily, either in the form of yoga or any physical activity you have to maintain. So yoga is good, gymming is good, swimming is good. Swimming is best exercise, although. And other thing like some form of physical activity has to be there, and diet control has to be there. If you have symptoms, if any one of your friend or if anyone of your colleague is having symptoms, the first and foremost is diet control and lifestyle changes. Lifestyle changes is exercise, regular activity, regular physical activity, and your food habits.
Okay, ma'am. So, ma'am, I also have a question. One more question. So, it is that why should we be educating boys along with girls about periods?
Okay. No matter who we are, we need a woman to maintain a continuity of lifetime. Na?
Okay.
Maybe as a mother, as a wife, as a sister, or as a daughter. So this continuity of life has to be maintained by a woman. So everyone has to know the importance of us like women, and everyone has to know like what is the normal reproductive system of a female and how it works.
Okay, ma'am. So, ma'am, thank you so much, ma'am. It is our great opportunity to hear you. It was a very good session and informative session. I once again thank you, ma'am, on behalf of our audience. So goodbye for now, ma'am. Stay tuned for next informative session. Thank you, ma'am.
Thank you. Thank you. It was an opportunity for me also. Thank you so much.
Yes, ma'am.
Welcome to Rhizome Group, a vision beyond.